Hello, my name is Trevor Bowling. I'm doing my PowerPoint on risk management for 503 Sports Law. This is a presentation that you can give at the beginning uh, of the year for all sports athletes, or you can do it at the periodically between at the beginning of fall, the beginning of winter, and the beginning of spring sports. So for the topics for today, we're gonna go over the ability to assess injury risk with sports participation and steps taken by school for player safety. That means planning, means management. We're just gonna kind of go over everything that could happen, ways that we could prevent it, and what the school is trying to do to ensure that each athlete is in a safe environment. So non-contact and contact sports may result in injury. These injuries may be minor, may be disabling, or they may be fatal. Okay, uh, there's no way to prevent every single injury that ever occurs. Just when you're involved in physical activity, there could be result of injuries that could result in those three categories. Okay, some injuries to look out for: concussions. Those are huge. Okay, these are getting more prevalent in today's society, especially in football, soccer, and all those other sports. Overuse injuries, we're seeing these more and more as athletes are beginning to specialize. All right, their bodies are getting overused. We're seeing a lot of injuries like that. Dehydration, where athletes aren't drinking enough water, or we're even seeing athletes who are intentionally dehydrating themselves in order to make weight in terms of regards for wrestling, and that is extremely dangerous, and we do not condone to that. Ligament tears, ACL tears, UCL tears, they're all pretty prevalent in today's sports world, especially at the high school level. And those are something that our staff is going to be uh, good at identifying. And also the last one, which is getting a little bit bigger the last couple years, is mental health. You know, sports play a huge role in developing self-esteem and that kind of stuff, but it also puts a lot of stress on a kid. And as a school, we need to be able to identify and address student athletes that have mental health issues and maybe help them. So, planning to prevent no injury is 100% preventable, but our goal is to make our environment as safe as we can. Okay. That means we have athletic trainers on staff. I believe we have two, and one is going to be required to be at every sporting event. Athletic trainers' jobs are to assess injuries, to rehabilitate our athletes, and also to educate them. Uh, they are CPR certified, they are AED certified, our coaches are CPI certified, and many of them know how to operate an AED. Emergency plans are also in place. That is where that list of injuries that we just went over, that is big because those are the most common injuries that we face. Uh, that way we know the most common. We're able to identify emergency plans for the most common injuries. And so that way we're ready for mostly anything that can happen. Uh, Education of athletes, like I stated earlier, they need to be taught the correct safety measures, like in terms of, like, take football for instance. They need to be taught how to tackle correctly, to lead with their shoulder and not to drop their head. That's a safety measure. They need to be taught the proper nutrition and the proper hydration, uh, and just overall how to take care of their bodies. Proper warm up and cool downs. These are all some things that have to be done. Warm ups usually are done correctly. More cool downs usually result in just practice being over. So coaches need to take that into effect. So, conclusion, participating in sports has risks, but we assure you that your player safety is our number one concern. Okay? Uh, it will always be our number one concern. And I think that if you address this to your parents, then we'll be good. If you have any questions, feel free to ask.